Hi guys, it's Dr. McJunkin here, and I'm excited to talk with you guys today about a very important topic. I'm excited to talk with you guys about diet and overactive bladder, and specifically, we're going to talk about inflammation and overactive bladder. And so, without further ado, let's kind of jump right into things here. So our little outline, you can see it there, but is diet and overactive bladder. Number one, we're going to talk about inflammation. Then we're going to talk about why do we get that? Why does that affect the bladder? Three, what is causing that? Four, what is the kind of current epidemic that we see in America? And then five, what do we do? And then my suspicion is this will be probably a multi-part because I think this is so important and so critical for so many people. I'm going to tell you guys a little story first. So, it was probably 10 years ago or more, I guess more than that, probably 15 years ago or so. I had a doctor who was visiting, and he came out to learn how to do certain procedures and techniques. And the doctor wasn't like a new doctor. He was at the time, so I've been almost practicing for about 20 years now, but at the time this doctor had been in practice for longer than me. But he was wanting to pick up some new skills and new techniques. And the interesting thing about this guy is he was actually kind of famous, at least in the medical doctor world. So he had written a book that a lot of us had used to study with. A really smart doctor. He was a doctor from Africa. And so before he came, I kind of knew his name and I remembered his textbook. And so I looked up a little bit about him. And then as I read about him, I'm like, he had just such an interesting bio. But one of the things he did is he wrote the Nigerian national anthem. So I was able to find it. And then when he kind of like came in the room, I played it for him and he was like so proud. But he was like, had grown up in Africa and became a doctor and was super smart, super hardworking, and basically really influenced that country. But also a lot of physicians. But one of the things that I really remember that he told me is he said, I know what causes all diseases. And so that really piqued my curiosity. And so I kind of like leaned in and I'm like, okay, this is kind of interesting. This kind of like legendary figure here is telling me what the secret is. What's the secret of medicine? And what he said, I thought was very interesting. But he said the secret, or he said the root cause, the reason for all diseases is inflammation. And I think at the time I was like, that's sort of interesting. Like I didn't have a huge response to that. But what's interesting is since that time, actually, there's something that's really developed out of that, and it's called the inflammation theory of disease. And so it's expanded kind of well beyond this guy, and so this is actually a really common belief that right now is that most diseases actually come from inflammation. And there's also another theory that's called inflammaging, and that inflammation is what causes aging. And so the example that they use for that is you might see two people who are both the same age, but they might look, 20 years difference in age. And so inflammaging is that one person, for all kinds of different reasons that we might discuss a little bit today, of that one person has a lot more inflammatory response going on in their body. And because of that, they have physically age much, much more than this other person who has a lower inflammatory response. So the first thing that I want you guys to be aware of is there's a theory called the inflammation theory of disease. And I think right now this is kind of the biggest theory as far as what causes all these different chronic conditions. So I'm going to tell you about some of the conditions that it affects. So In the brain, we think that there are pro-inflammatory cytokines that cause autoimmune reactions, which can lead to depression, autism, poor memory, Alzheimer's, dementia, MS. In the liver, you can build up inflammation, which can lead to enlarged liver and fatty liver disease, which is really, really common. And basically, you get an increased toxic load or buildup in the body because the liver is supposed to clean everything. It's the big filter for the body. And so if that's all clogged up, it's not going to filter. And then all of a sudden, all the junk is going to go everywhere else in your body. In the skin, you can get chronic inflammation, which can affect, which can give you rashes, dermatitis, eczema, acne, psoriasis, wrinkles, fine lines. In the thyroid gland, inflammation can cause autoimmunity, disrupt thyroid function. So hypothyroidism is an extremely common condition, very common, and affects so many different people. Cardiovascular inflammation in the heart, in the arteries, in the venous walls, contributes to heart disease, strokes. Diabetes can affect that. High blood sugar can affect and damage those vessels as well. Anemia and cardiovascular disease, obviously, that's the number one killer. Heart attacks, strokes. But all of that relates to inflammation. In the lungs, you can get autoimmune or inflammatory conditions. Of course, we've all heard of things like COPD, but you can also get allergies, asthma. In the kidneys, you can get inflammation that restricts blood flow. Then you can get swelling, high blood pressure, inflammation of the kidneys, and even kidney failure. In the GI tract, you can get intestinal damage that can result in things like GERD, Crohn's disease, celiac disease, and then things like IBS, inflammatory bowel syndrome. In the bones, it can cause problems with bone healing, with decreased bone mass. And so that would be like osteopenia, osteoporosis, and then eventually fractures, unfortunately, for those people. In the muscles, it can cause muscle pain, weakness, things like even carpal tunnel potentially, which, is more nerves than muscle. There's something else, polymyalgia rheumatica. So those are some of the really, really common ones. And of course, we also think about external things, gum disease, gingivitis, diabetes is an inflammatory condition, eye problems, joint problems, arthritis. So the list kind of goes on and on and on. And now what we know is a lot of cancers also relate to inflammation within inside the body. So there's good evidence on colon cancer, breast cancer, lung cancer, and I think almost every kind of cancer, skin cancers, almost every kind of cancer. So that is the first point, inflammation. The second point is why. And so what is inflammation causing? So I didn't mention the bladder there at all. I didn't mention overactive bladder at all. But I'm going to read you just this little sentence that came out of an article. Now significant clinical and preclinical evidence shows that overactive bladder is related to structural, synaptic, or intrinsic changes in the complex signaling pathways that mediate bladder sensation. So what that essentially saying is now there's a lot of evidence that overactive bladder is related to damage to these nerves. And those nerves aren't working right. And we've kind of talked about this before. Like the number one cause of overactive bladder, the reason people have it is the nerves aren't conducting well, they're not working well. But the reason is, why are they not working well? And the answer, in short, is inflammation. So that's the why. Now we're going to talk about what. What is this from? What's all this inflammation from? And I would love for you guys to tell me in the comments, what do you think inflammation is from? What do you think, causes some of these different things? I'm going to tell you some of the things that I think. So I think diet might be the very biggest one. And so we can talk about that. Today's talk was supposed to be about diet, but as I dove into the evidence and the research and looking at inflammation, I'll tell you more about that as we go on. diet is so extremely important, but we can talk about what can we change in our diet potentially that might help those nerves. Toxins in our body. We talked about toxins building up in the liver if the liver's not working properly. There's a lot of theories about bacteria and viruses staying around in the body, and now we start having an understanding that we are made up of bacteria ourselves, and there's actually 2 bacteria for every one of me, and same for you. And our bacterial health, having the right kind of bacteria, is so important. So there's a lot of information about gut health and leaky gut. There's a lot of information about stress, heavy metals, heavy metal toxicity, things like aluminum, cadmium, mercury. All of those things can damage nerves. Well known that those can damage nerves. Mold, if you've had mold exposure, genetics. Just, plain old, your mom had this, your sister has this, and there's a genetic component. And then aging over time, we are more prone to inflammation because we can't fight off those things quite as well. Okay, so then we are going to, that was kind of we talked about inflammation, how it affects every system in the body, and really might be the cause for most conditions. Why is that affecting us? What is happening? The next thing I'm talking about is the epidemic, and I put this image before in one of the precursors, and it was kind of a weird image, and it's all red, and there's a little bit of blue, and I'll try and link it maybe in the comments here, a little bit of green. But there is something in America called metabolic syndrome, and it's also called Syndrome X. But in America, at least, and in the Western world, about 40% of people over the age of 60 have this thing called metabolic syndrome. And it basically involves carrying more weight than we should, having higher blood pressure than we should. Oftentimes it has some cholesterol imbalances, and then our sensitivity to things like insulin has gone down. So metabolic syndrome, high blood pressure, and you don't have to have all of these things. It's a cluster of symptoms. You're at a higher risk of cancer, higher risk of dementia, higher risk of heart disease. And remember, all those things that I just talked about, metabolic syndrome is essentially this inflammatory condition that's happening to people. Higher risk of liver problems and fatty liver, insulin resistance, where we'll talk about that just a little bit, lipid problems, and then you're predisposed, you're kind of usually an early type 2 diabetic at that point. That's called the metabolic syndrome. Massive, affects 40% of people. And really predisposes you to all kinds of medical problems. And one of those issues with metabolic syndrome is you're carrying more weight. So here's one article that I looked at. Central and general obesity were key metabolic factors associated with urinary incontinence in both male and females, with overactive bladder in females but not in males. And so basically, if you are carrying extra weight, this is the really interesting, I think. If you're carrying extra weight, what we know now, and we consider that extra fat its own organ, and this wasn't like this when I was in medical school, and that organ, if you can believe it or not, is an inflammatory organ. It's just always sending out inflammation into your body. The little bit of extra fat that you're carrying is always sending out inflammation into all of your body. These bladder nerves are real sensitive, and so when they get damaged, all of a sudden we start to develop this cluster of symptoms that we call overactive bladder. There's something that's even more cutting edge than that, and it's called visceral fat. I'm going to take a quick drink here. So visceral fat is not the little bit of fat that we have on the outside of our body. I should show you up high where you can see it on the outside of our body, but it's actually the fat that surrounds our organs. So the interesting thing that researchers are starting to figure out is that this little bit of external fat that we have on the outside of our body is actually good for us, and it's not inflammatory. But the fat that we have that surrounds our organs, and so a good example of this is a middle-aged man. We call it a beer belly, but your gut kind of starts sticking out, protruding more and more and more, and I think all of us are familiar with what that looks like. That oftentimes is visceral fat, that fat in the inside part of us. But that is like a smoldering fire. It's an inflammatory fire that's just burning and burning and burning and burning. And so here is a research study. Here's one that talks about body mass index, or basically if you're obese or not, and your waist circumference, how big your waist is, are crude methods to correlate with overactive bladder. And so now I have seen plenty of people who are very, very thin who have overactive bladder. But this visceral fat thing is really, really interesting. So one of the things they found is marathon runners. I mean, a lot of them are very, very thin, but their body holds on to this extra little bit of fat to protect their organs and just have a little bit of reserve supply because they're running on empty so much of the time when they're going for these long marathon runs. That visceral fat continues to do inflammation even for these really thin people. So a lot of people think, geez, if I can just lose a few pounds, maybe this overactive bladder will get better. For some people that does help, but for a lot of people, it's that deep visceral fat that takes a long time to get rid of, and there's special ways to do it. And only then can you get rid of that inflammatory fire that's going on. Now the question really is, if I get rid of the inflammation, will my overactive bladder get better? And I think the tough answer to that is I think it depends on how long it's been going on. So my suspicion is if it's been going on for years, a couple of years, then those nerves might be damaged beyond repair. And I don't know the answer to that. I don't think anyone does right now. If it's 10, 20 years, probably definitely beyond repair. But we can always try and improve ourselves. Here's another study, and this one specifically is the only study that I found, and it's the picture that I put up that was red, blue. I'll put it in the comments. There's 182 patients divided into overactive bladder. There was 71 of those people, and non-overactive bladder, 111 of those people. The visceral fat area, so you have to get a CT scan and really MRI is the best thing you can look at. The visceral fat area, visceral fat volume, and total abdominal fat values were all significantly higher in the overactive bladder group than in the non-overactive bladder group. And so again, this is telling us that inflammatory condition, and even on the CT scan that I provided, it looks like a relatively average person. Then they don't look like they're obese or anything like that at all, but they have a lot of visceral fat. That is a real good predictor of overactive bladder. And so that correlates really, really well, and that's probably one of the big underlying causes. Here's another study, and it's an association of metabolic syndrome. Remember we talked about that, or syndrome X, and overactive bladder in women. Conclusion, this present study found that the higher the BMI, the longer the waist circumference, the higher the LDL and fasting glucose levels. So basically, the more of the metabolic syndrome that you have, the more likely it is that you might have overactive bladder. So you might be asking me, okay, fine. All this stuff's going on in my body, and I have, things that aren't fun. Why does it matter? And two, what can we do about it? But I think the first question, why does it matter? I think it really matters because we know that your quality of life drastically decreases with overactive bladder. Now there's a lot of research that overactive bladder correlates with coronary artery disease and postmenopausal women. So again, if you have inflammation going on one place, it's probably going on someplace. And unfortunately, we saw this in one of our patients recently. A woman that was healthy, vibrant, energetic, and we treated her bladder, and she actually got some improvements, was able to sleep better, all those kinds of things. But several months later, she actually had a heart attack. And so she did not seem very big at all. She seemed like she was in very good shape, but she had that inflammatory fire cooking that was aggravating that. So that's something that I want you guys to be aware of. Okay, this is kind of going longer than I thought, but I think it's so good and so important and critical information for you to know. Before we get to the final thing, let's see. Okay, I just got an email today, and this was about this inflammation, the silent saboteur of your health. 9 signs are not to be brushed aside. Again, we talked about some of these aches and pains. These are all signs of inflammation. Fatigue, brain fog, allergies, autoimmune diseases, acid reflux, candida or other microbiome dysbiosis. And gut health is actually becoming so important, and I think almost everybody has some gut health imbalances. Recurrent bladder, yeast infections, and skin conditions like psoriasis or eczema. So again, that's a outside email that's just saying inflammation, really affects all these systems in our body. So the final thing, and I think what we'll probably spend more time on next time, is what to do about it. So I would love to hear your guys' comments. Do you feel like inflammation is affecting your body beyond, bladder? How is it affecting you? And then maybe what have you done about it, or what are you doing about it? So I will say, first of all, what we do here at Bladder Centers of America, I specialize in a procedure that helps people with overactive bladder, and it really improves people's quality of life, makes an incredible difference for the vast majority of people. One of the big things it does is it helps people sleep better. If you're not sleeping well, that's the fastest way to get your inflammation out of control. It also gives you, it allows those nerves to work better. So it kind of addresses the underlying issue for why overactive bladder occurs, where medicines just don't really do that at all. So it dramatically improves, but even after we do that therapy, one of the things we recommend is lifestyle changes, because we understand that overactive bladder is an inflammatory disease, and so that's part of this kind of process. So what can be done about it? So I'm going to just briefly mention a few things, and then I think we'll spend a whole nother talk on this. And these things I'm very, very passionate about this. And one of the things that I've studied is called functional medicine, but it's looking at the root causes of diseases and trying to come up with the very best solutions that address the root causes. So what can be done about massive amounts of inflammation in your body? Physical activity. There's some good evidence that that part of this whole metabolic syndrome, or this inflammatory condition, is that you have high levels of insulin in your body. And so we know that you also have high levels of glucose, but both of those can be damaging to the cells and to your organs. And that itself leads to inflammation, immune problems, so on and so forth. So physical activity actually sensitizes the cells where they can actually work with insulin better. Diet is massive, and that's kind of the focus of this. But it's real important to know that there are fats, proteins, and carbohydrates. Those are the 3 big, we call macro classes of nutrition. Fats, if you eat fat, like you eat, let's say the grizzle off steak, which I don't like eating, but let's say you eat that, and you have a monitor that monitors your blood glucose all the time, your blood glucose will not go up at all. So fats get broken down in your gut. They go through a different system in your body. They actually go through the lymphatic system, but they do not increase your blood sugar at all. So you don't have insulin go up, you don't have a response. And so that's part of the basis of what we call the ketogenic diet, where you're not using glucose as your body's primary fuel. Instead, you're using ketosis. And so the other thing there is protein. Protein actually spikes your blood sugar just a tiny bit. The funny thing is no one actually knows why. So ketogenic diet usually is high fat, high protein. And then there are some extremes of that diet, like carnivore is one where you only eat meat, eggs, and cheese. I've done that diet. Carnivore is where you're mostly ketogenic is where you're eating all protein, all fat, and trying to avoid carbohydrates as much as you can. And another version of that is called the Atkins diet. You guys have probably heard about that one. That's a really strong anti-inflammatory diet because if you're eating carbohydrates, even if they come in the format, and really I should say refined sugars. So no matter what diet you eat, I think if you eat a pure whole food diet, so let's say you decide vegetables are the greatest thing that ever happened, you could eat vegetables and fruit. That will spike your blood sugar to some degree, not as much as like Oreos, but because they're more complex carbohydrates, your body breaks those down and they just are treated differently in your body than refined processed sugar carbohydrates like pasta, things, like all fast food, all junk food, all of that stuff is refined processed. And that's the standard American diet. We've been told you should eat a lot of grains, you should eat corn, you should eat, and that's all been a big lie. Another one that's huge and popular right now is seed oils. And those are also called vegetable oils. Interesting, I was reading about those, and those are, first, when they were processing things like corn, they had all this extra oil, and they didn't know what to do with it, and they threw it in lakes and rivers, and they junked those up. And then they started saying, hey, we could put this in our cars and use it for tractors and machinery, and they started doing that, and they were selling it as oil for like your car and for parts. And then eventually it actually came into fashion to use that in our diets. There's a big study in Japan. People were eating exactly the same amount of calories, but it was the introduction of those vegetable oils, or seed oils is what they are commonly called now, and basically obesity doubled. So again, same amount of calories, but the only difference is these people were adding in seed oils. So seed oils, I think most people now are starting to think that's a really big toxic factor and a big poison for our bodies. And a really inflammatory thing because our body doesn't process those very well. They're very, kind of, I would say, unnatural for us. And I think some of it's just getting back to the basics. So there's a lot of evidence now getting out in the sun, sunlight helps people. Movement, we talked about that, exercise, non-processed foods, sleep. Sleep is so important. I know we've had a little bit of information about that, but that's so important. Stress reduction, really hard to do, but so important for us. And then remove toxins. And so these are things like alcohol, caffeine can be a toxin for some people, other irritants specifically. If something's irritating your gut, spicy foods, this and that, it likely is irritating your bladder. The bladder does have some specific things that it doesn't like. Caffeine can be one of those things. Okay, so today, I know there's a lot of information, but we talked about diet specifically. We talked about inflammation and overactive bladder. We talked about the link and the connection between those two things. We talked about why that occurs, what it's from. We talked about the epidemic of metabolic syndrome and how that's affecting all of us and how that also affects our bladder. And then we spent some time on what to do about it. I'd love to hear what you guys have to say. You guys, my suspicion is you guys haven't heard this stuff before. A lot of this stuff is basically brand new. And I would love to hear your all's comments. Next time we're going to talk about more about what to do. And we'll talk about that anti-inflammatory diet, anti-inflammatory lifestyle. And thank you guys so much. God bless you guys and have a wonderful rest of the week. Bye guys.